Thank you, Saul, and good morning, innovators. I know you're out there. Yeah, this is very cool for me. I have to tell you that, mostly I talk to a lot of board members and physicians and sometimes investment types, but I don't get to talk to like-minded people very often, and this is really fun. Because, when I think about healthcare, and I've been in it a long time, I don't really think it's very innovative. Does anyone agree with me? Yeah, I mean, it's kind of scary when we think about our debt, the amount we're spending in healthcare, and the lack of innovation, particularly around how we deliver care. It's not just the technical aspects, and many of the great technical innovations have been amazing. Certainly in my career, I go back far enough that I remember when we didn't have hips and knees that we could replace. There are a lot of other surgeries, frankly, we do today on very elderly people safely. So there has been innovation, certainly in clinical care, but how we do the work is really interesting. So when I think about how do you transform, how do you create cultural innovation in healthcare, it really is about leadership. And not just what we do or even what we say, but frankly, it's kind of how we make people feel and who we are as leaders. And for me, my passion in healthcare began very early in my life because frankly, as a young person, I had terrible hospital experiences. When I was 5, I was in the hospital for a week, and the visitation hours from my parents were so limited that I felt scared every minute. And then 5 years later, my mother was very ill, was in the hospital for a month, and 4 children at home, ages 2 to 12, none of us got to see her for a month. Terrible. I mean, very insensitive, frankly, to the needs of patients and families. So I had a passion very early on. I also had great parents that basically told me I could do anything. They told all of us we could do anything. And they also believed very strongly in stepping out of the normal path. They allowed us, frankly, they wanted to expose us to everything. They allowed us to create our own path in a way that was really wonderful. They wanted us to be different. My mom used to say, I don't care what the other kids are doing. I care what you do. I talk to a lot of parents all the time. I am a parent myself. It's one of the most important things that I think about, is how do we motivate people, frankly, to be incredibly innovative by not being, afraid to be different and not having peer pressure affect us. My mother was a teacher. That helped. She understood peer pressure, and she didn't want her kids to kind of be in the wrong group. So, as kids growing up, all the kids came to our house. My mother interviewed all our teachers. She had them over for lunch. Can you imagine that? 4th grade. I walk in the living room. There's my 4th grade teacher. Oh, my God. It was horrible. But she wanted to check them out to make sure they were doing a good job, which was actually a pretty good idea in retrospect. My father was an inventor. My dad was a nuclear engineer. He's going to turn 90 in about a month. He has 8 patents. He was a problem solver. He always told me, Nancy, I solve problems in our company. The ones that nobody else could figure out, those are the ones I like the best. So, that kind of passion, that kind of upbringing certainly has helped me, I think, in my life. But when I was in college, I realized that I wanted to go into this thing called healthcare. And I decided to go about it in sort of a different way. I finished my college degree, and I started taking minimum wage jobs in hospitals to get experience to understand the complexity. I mean, there are reasons why it's hard to change healthcare. It's an incredibly complex environment. Even Peter Drucker said it was the most complex management environment he'd ever seen. It's true, because you've got all these professional groups, you've got individuals coming to be cared for, and standardization, while important, is not always possible. Because each person is different and has different needs, different cultural needs, language, you name it, we deal with it in healthcare. So it was very important, frankly, to me to understand this environment. So I took a lot of frontline jobs. I've done lots of things. I was a nurse aide. I was a unit secretary. I was a switchboard operator. I worked in the ER. And I learned so much about the complexity and how to really empower individuals. I also, when I was in college, read a book called Small is Beautiful. And while I was an individual that kind of sort of naturally gravitated to complex large organizations because I never wanted to be bored, and found them intriguing and fascinating and incredible people that I would get to work with. I also felt that we had to make large organizations feel small. that we really needed to pay attention to each individual in the organization as we were trying to embark on transformational work. So that small concept has always been important to me. And I was basically a chief operating officer or a CEO of a hospital for about 20 years of my life. And I wasn't sure I ever wanted to be sort of the corporate type. So when I was asked to be considered to be a CEO of a very large organization, we're over $4 billion in revenue, we have 24,000 employees, I thought, this may not be for me, because I like to be with the people. So I talked to our board, I said, you know, I'm not the same kind of CEO as my predecessor. Is that okay? And they said, yes, it is okay. Because my goal was to make it the best organization possible, and frankly, to figure out ways that we could transform healthcare and really make individuals feel incredibly satisfied every day in their work. And that's hard to do in healthcare. I mean, the demands of any of the jobs in healthcare are incredibly difficult. The emotional demands as well as the physical, and frankly, the intellectual demands are extraordinary. And yet, you know, typically, a lot of the administrative people that we have in hospitals aren't very sensitive to those needs. And it's a problem. So, you know, what do you do to create that kind of environment? First of all, you're not a faceless corporate person. You know, you have to be real, you have to be out there, people have to know you. You have to storytell just like we are today. You have to talk about why you're doing this work, why it's important, what motivates you, and really create that environment. So there are, you know, 3 principles, frankly, that I use a lot, and I'll tell you a few examples of how that's really changed our organization. One is this focus on people, and I look for the disruptive people. I try to find them. And when people come to me with the crazy ideas, I put my arms around them, because those are typically the ideas that drive the change. So, for example, you know, I had a chair of surgery who came to my office, great guy, used to work for NASA, wonderful human being, a Renaissance guy, not a typical surgeon, frankly. And he came to my office, he said, Nancy, I've got an idea. I want to put kiosks in churches and help, particularly our African American churches in Detroit, focus on health and wellness. Can you imagine a surgeon doing that? It was news to me. And I said, Scott, that's a fantastic idea. How can we do that? Well, he had this organization he was working with. They were called Imagineers, and they created these kiosks. We now have not only kiosks in churches, but we're moving them into schools and community centers where people can basically use them. They're very user-friendly. They can be customized for that organization. In fact, our name isn't anywhere on these kiosks. It's really about how we create an environment for health and wellness in our community. So he's an amazing example. We had a chair of urology that came to me and said, you know, I'm working with a company called Intuitive, and we want to adapt robotic technology to prostate cancer care. And he said, but you know, there's a bit of a challenge. We have to completely revamp our OR to be very much sort of a, you know, 21st century, high-tech, amazing environment for providing this care. Very expensive, and we didn't have much money back 10 years ago. But I said yes, very important that we did that. We've now become the largest site in the world and the first site in the world to do robotic prostatectomies on prostate cancer patients. We've trained most of the other surgeons around the world who now do it. So another example, basically, of people making a huge difference. We have a nurse, frankly, who is an amazing individual. She works in our dialysis center. And she wanted to come to Henry Ford because she knew we had this environment about, you know, sort of allowing people to do their thing. So you know what she does every weekend? She's at home. She's an artist. She draws beautiful, inspirational sayings, beautiful cartoon figures and fun figures, some Disney characters, on disposable gowns that the staff wear for the dialysis patients. So when they come in on Monday morning, they can't wait to see what she's done. Now, these all get thrown away. They're disposable. Can you imagine this? But this is what she loves, and it's her passion, it's her purpose, and she delivers on it every day, you know, creating that environment that allows her to do that. And then we've got this guy named Gerard, who some of you perhaps have heard. Gerard is a guy I hired from the Ritz-Carlton to basically open and lead our new hospital, which was a transformational kind of hospital. a hospital that allowed us, frankly, to bring health and healing to our community. We're a health and wellness center. Gerard is an amazing guy. He didn't know a thing about healthcare. But what I saw in him was a leader who had amazing skills in leading people, inspiring people, and frankly, allowing people to do incredible things. Gerard also had a different idea. People in healthcare, frankly, can't really see things the way others can. So one of the things that we've learned now through Gerard is bringing people in that have a different set of eyes, totally different way of looking at things, is so critical to making transformation happen. So we are now bringing a lot more people into our organization from very, non-traditional backgrounds that have allowed us to see things in a new and different way. And it works, because Gerard, in essence, had to counter a lot of negative criticism, I can tell you. He had to be courageous. He had to be an individual that said, I've got these ideas, I think they really can work, and get the doctors, the nurses, all the sort of traditionalists in the organization to buy in. But, the story is amazing. This is a hospital that just opened a little over 3 years ago. It has grown tremendously. We started with 0 market share. They're now bigger than 20 hospitals in the Southeast Michigan marketplace. We have 99 percentile on patient satisfaction, the highest quality scores. Pretty amazing. And it's now profitable. Cash flow positive after 1 year. This is because of leadership and alternative kind of thinking. If we had been traditional, that hospital would have failed. I absolutely know it, because we're in a mature market, a lot of competition. So it was just tremendous. So saying yes, helping people who are disruptive, think differently, put your arms around them, help them through what are always going to be the naysayers and the people that basically don't believe what you're doing. It's fun to prove them wrong, I will tell you, though. Really fun. Especially our competitors who had ads on the TV basically saying, we're not like the Ritz-Carlton, we take care of real patients. I'm like, great. Now they're not saying that anymore. It's pretty nice. But, the other thing that we've learned is that in addition to people focused saying yes, is it really is all about collaboration. I have had a theory for a long time that the gold in life is in the intersections. It's in the junctures where we come together, we work differently, we solve problems differently, we bring different thoughts. And so every example of where we've been different at Henry Ford has been about those intersections. We own a health plan and we have a delivery system. When our health plan leadership and our doctors and nurses get together, they come up with amazing things to manage chronic disease better, to bring e-prescribing to all of our physicians in a way that reduces costs, improves quality, improves convenience for our patients. When we work together differently across the silos, that's where wonderful things happen. And the same is true in our community. We're collaborating significantly to help transform Detroit, because we think our responsibility as an anchor organization in Detroit is to help transform. And we know we're not going away. We're not, outsourcing to other places. We can't put new sites elsewhere. We're a community resource. So it's very important that we collaborate with everyone. So one of the cool things we've been working on now for the past few years is what we call our Midtown Collaborative. And in Midtown Detroit, we have a real opportunity to improve the neighborhood, improve the retail services, improve all of the opportunities for people to live and work in a great environment. And we created a program called Live Midtown, and we provide incentives to our employees so that they can buy homes, rent apartments, condos, and even repair and improve their homes if they've been residents there for a long time. We're spending $200,000 a year with foundations matching. Again, a great example of collaboration. We work with the Detroit Medical Center, we work with Wayne State University. We're all doing this together. And that has actually now motivated the downtown companies in Detroit to do the same thing. So all of the other companies, GM, Blue Cross Blue Shield, CompuWare in Detroit, they're all working together to basically incentivize their employees to bring more people into the community, more young people, frankly, and empty nesters who really want to be there. We partner with the schools, we partner with churches, we partner with community organizations. We're partnering with the College for Creative Studies and their students to actually help fuel our new Innovation Institute, which is very exciting because these young students, frankly, again, see the world very differently. These are students that used to design Nike shoes and automobiles, and they come into healthcare and they look in our waiting rooms and they say, there's a lot of stuff we could make better here, And then they come into our ORs and say, these poor doctors are leaning over the operating field, their backs go out, they tend to have shorter careers because of the way in which they're doing their work. The designers see the opportunity. They came up with ideas for new shoes, new surgical outfits, basically to keep them energized during surgery, and a chair idea to put over the operating field. How cool is that? And my favorite idea, frankly, is the idea of creating a new patient gown. What do you think? Really fun. I've been trying to do that for actually my entire career, but these design students came up with the best idea I've ever seen. And I'm not going to share it yet, but it'll be coming. So anyway, in conclusion, my basic role as a CEO, I believe, is to create an incredible environment for every person to reach their full potential. That means our patients, it means our staff, it means our community members. So thank you so much.